Good afternoon, everyone, and welcome to today's Health Policy Institute webinar. I'm Marko Vujicic. I'm the Chief Economist and Vice President of the Health Policy Institute at the American Dental Association. I'll be hosting today's webinar. First, I guess we would like to just send best wishes and hopes to all of you joining that you and loved ones are safe and that you have hopefully found some rhythm and normalcy both in professional and personal lives in what is anything but a normal situation. This is likely probably the professional and personal challenge of our lifetimes and of our careers. Today is the first in a series of webinars that the Health Policy Institute will be hosting on how COVID-19 is impacting the dental care sector. For those of you that may not be familiar with the Health Policy Institute, we are a think tank housed within the American Dental Association. We do scholarly research on various policy issues in the dental care sector. These are snapshots of some of the series of our publications. Both scholarly journals, quick and short infographics, opinion pieces, as well as increasingly and probably most rewarding, a lot of our work has been used directly in policy making, both at the state and federal level, in the popular press, and increasingly with industry folks as well. And recognizing that last one, we last year launched a consultancy service targeted toward the private sector. We're realizing that a lot of our capabilities and data are worthwhile to a lot of companies in the sector. Okay, so zooming out today, obviously COVID is having a major impact on society, on the economy, on healthcare, and on dentistry. So today we are going to focus very specifically on one topic. We want to walk you through some data and analysis that we've done in the Health Policy Institute. Future webinars, which I'll talk about towards the end, will focus on a variety of other topics. But in terms of housekeeping, you'll notice that there is a raise hand function and a Q&A function. I have my team that's monitoring the Q&A box is where we would like you to submit questions or comments as we go throughout the webinar. Do not use the raise hand function. Please focus on entering any questions or commentary in the Q&A, and we'll hold those to the end and hopefully get through as much as we can. This webinar also is being recorded, so please be aware of that, and feel free to share it. You'll all get notices afterwards. And I think that's it for now. So let's get into this. So as I mentioned, here's our work. Basically, what we're going to focus on today is the first one. We've been tracking a very large sample of dentists over the past 3 to 4 weeks now. And we have 2 waves of data focusing on what's the situation on the ground. We're also in the thick of doing some modeling about the potential future impact. I'll talk a little bit about that. And as I mentioned, we are April 29th. You'll get notices of this, but we're having a panel discussion with several other industry experts who will bring some different insights. And again, that's part of our role to help facilitate discussions among thought leaders and policy experts. So keep the questions coming in Q&A, and here we go. Obviously, these are just some snippets that are in the recent press. A lot of uncertainty, obviously, around how things will go in terms of recovery. The bottom is just a headline that was, I believe, just a couple days ago in the Washington Post. But let's get into what we've done in terms of the HPI work. So we had responses the week of March 23rd from almost 20,000 dentists. We invited a subset of those to join our longitudinal panel, which we'll be following over time. And the second wave of data collection we did last week. And that is based on just over 6,000 responses among the 12,000 who had agreed to be part of our panel. So long story short, these are extremely large numbers and reliable, and we won't go through all this. We've checked for representativeness. This is not members only. This is pretty representative of the population of practicing dentists in private practice. And particularly, we were very pleased with the heavy response rate in wave 2 among those that signed up to be on the panel. So the first thing we asked is, what is the current status of your dental practice? As all of you know, there have been various approaches across states in terms of delaying elective care. The ADA issued recommendations that are now through the end of April that dentists should delay elective dentistry at least through the end of April. Some states have done something earlier, some states have done something later, some states have done nothing at all. But the first thing we wanted to ask was, are you open as usual? Are you open with lower patient volume than usual? And then are you closed except for emergencies, or are you closed completely? So you see here the results of the 2 waves of our data collection. The week of March 23rd, we basically had 19% of dentists fully closed and not seeing any patients. We had another 76% who were open for emergencies only, which was the guidance that the ADA, for example, issued, and the CDC. And then we had, I think, literally 0 that were open with business as usual. And then there were some that were open kind of regular hours, but lower patient volume than usual. Not much change last week compared to the 2 weeks prior. As you'll see there, a little bit of movement away from the yellow. But I think this demonstrates that largely early on, I guess, in the pandemic, dentistry, largely shut down early and effectively, I guess, is what these data are telling us. Just so you know, in addition to the webinar being recorded, on our webpage, ada.org/HPI, we actually built a very user-friendly interactive dashboard where you can get these results. So these charts I'm showing on the screen, most of them are actually going to be in the report that anybody can look at. You'll see we also have state-by-state data. So that's something I'm really proud that the team collected data and created a very nice interactive visual dashboard in a fairly short time. We do some basic crosstabs or analysis by different profiles of dentists. So for example, this is the question on are you open, or what's the current status of your dental practice? According to, we did it for solo practitioners, we did it for smaller practices, 2 to 9, and then we had a category of large practices. I'm just pulling out some interesting things that were different or that varied across different dentist demographics. One of them here is that it seems that larger groups had more likelihood of being in the tail, meaning that more of them seemed to be open as usual, and more of them also seemed to be fully closed. Whereas in the solo dentist, there was much more of this open for emergencies. Not sure what explains that, but it was something that varied. This is not in the report. This is something we just pulled together recently, but here it is by different specialty. And as you can see here, oral surgeons and endodontists are the only real outliers here in terms of specialties that were much more likely to be open with lower patient volume versus fully closed. And again, I'm not a dentist, but this is somewhat understandable. These tend to be the urgent cases. Others have also suggested that infection control and different things may make these specialties more likely to limit the risk to patients and providers. Again, that's not our purpose today. We just want to showcase some of the data and what we're finding, not so much explain what's behind all this. So definitely those two specialties are different than the rest. Perio seems to be fully closed except for emergencies or closed period. What's really interesting is we have so much data, we can cut it by state. This is just, again, a rough snapshot as of last week, how some of the status of dental practices varies by state. The states towards the right are the ones that have the highest share of dental offices that are fully closed, even for emergencies. Vermont, Pennsylvania was one that was important. They had the most restrictive practice recommendations as of March, and I think they relaxed those a couple of weeks ago. So this wave, we saw Pennsylvania had a big jump. That's not what we're showing here, but it's still one of the states that has the highest share of practices fully closed. And on the left side are places where there's been, I guess we can say, maybe less of an impact in terms of closures. Montana, North Dakota, Wyoming, Alaska. Very few practices reporting that they're fully closed, even for emergency patients. One more housekeeping thing I forgot to mention. I don't know if some of you are joining only by phone. I should have warned you that will be quite uninteresting. I'm not as articulate as the visuals that are produced by my team. So stay with us. Hopefully you get the gist of it. But again, this will all be recorded and available later. The second thing I wanted to mention in terms of housekeeping, and I should have mentioned this at the beginning, this webinar is really going to focus on the data on business issues and patient volume and things like that. We're not going to get into anything clinical. That's not a focus area of HPI. So if there's any kind of dentists following online, I want to just manage expectations. We won't be talking about what new guidelines are for PPE or where you can get N95 masks. There's a whole other resource at ada.org/virus where you can start, and the ADA has been putting a lot of information and webinars out there, and those are all available on that website. But the focus today is really going to be on the economic impact. Okay, the second thing we ask dentists is to talk about their patient volume and the volume of total collections. And we ask them to compare it to what's typical. So how does this week compare to what is typical in your practice in terms of total patient volume and the volume of total collections? Now this question we changed, so we do not have a comparison to the first wave of data. So these are the data as of last week. And as you see here, 84% of dentists are reporting that their patient volume last week was less than 5% of what is typical. And then there's another share, 7.8%, reporting that their patient volume last week was about 5 to 10% of what is typical in their practice. And then there's a very small portion with higher patient volume numbers. So, I mean, in a nutshell, the dental sector has largely shut down. There's very, very small patient volume compared to what's typical. But there is some, which I guess is good news too, right? That the point of the restrictions was to, again, protect dentists and patients in flattening the curve and contributing to that part, as well as conserving PPE for other healthcare professionals. But the point was to make sure that emergency cases still can be seen and that they don't end up in hospital emergency rooms, which is the last thing we want ever, but especially in a pandemic. So it's good that there is still some patient volume. And in terms of volume of total collections, you hear the statistics there. You see the statistics there. Not as drastic a reduction, but again, roughly 68.5 plus 15.6. Let's call that, 85, 84% of dentists are at less than 10% of their typical collection. So a dramatic reduction in patient flow and revenue in dental offices as a result of the practice restrictions. And here again, just pulling out some of the interesting differences. Here on the top bar are, well, let's say on the bottom bar are dentists that are affiliated with a DSO or a dental service organization, and compare that to all other dentists in the top half of this chart. And again, the differences are not dramatic, but they do suggest that the DSO dentists had a slightly smaller reduction in total patient volume, and a slightly smaller reduction in terms of total collections compared to other dentists. And again, we don't know, that could be anecdotally. I mean, I talked to a lot of industry execs and leaders, and one of the things I think the DSOs probably invested in more than the typical small practice is platforms like teledentistry and proactively trying to manage patient emergencies so that they don't end up in the hospital. It could be that. It could be that fewer of them simply closed and we're seeing regular patients. So we don't know. Both of those hypotheses could be true. And here's the similar data by practice size. Again, I think as you go top to bottom, you move from solo dentists to smaller groups to very larger groups, which in this case we're defining as 10 or more dentists. And you see that purple bar kind of get a little bit shorter. So again, similar to the DSO slide, it seems that the larger groups are seeing a slightly smaller reduction in patient volume and a slightly smaller reduction in volume of collections. But I mean, it's not like anybody here is anywhere close to business as usual. I think what these data show very dramatically is that everybody has really seen a complete slowdown / shutdown in terms of what's happening on the dental patient side. Just another reminder, I just see a few raised hands popping up. Please use that Q&A box if you have any comments or questions. Big comments or small comments, all of that, the team is monitoring that as we go. And here are those collections data, again, by state. It's another great aspect of this survey is we have tremendous sample size. So in this chart, we've organized it by the percent of dentists reporting that their collections are less than 5% of what is typical. So let's call that a very dramatic reduction in collections. And if you're on the right-hand side, you're in that bucket of severe reduction in collections relative to the states on the left side of this chart that have had, well, relatively less severe. But again, everybody's being quote unquote hammered or negatively affected here. But again, Utah, Idaho, Wyoming, those same states are popping up as having a slightly less negative impact. And the states, again, Vermont, Pennsylvania, those are two that we highlighted where the vast majority of offices have closed. Well, more have closed in those states than in other states. And conversely, we're seeing that same message coming through with collections. So there is some variation. Obviously, I'm sure some of you are asking, how does this overlay with how states restricted practice, when they did it, how severely they did it? I don't know if Utah, Idaho, Wyoming had any restrictions on dental procedures in terms of delaying elective care. That's something we're going to look at once we kind of get a little bit more data on this. And finally, the third question we ask and will continue to ask is related to paying your staff. So we asked, is your dental practice paying staff this week? And this is actually where we saw the most dramatic change last week compared to 2 weeks prior. And so you see here in this chart, the week of March 23rd, we had just over a quarter of dentists reporting that their practice was paying their staff fully. And we had 28% saying that we could not, we're not paying any staff. That increased dramatically. So we're now up to a situation where 44% of dentists indicate that they're not paying staff at all, which is a significant increase. And we have a reduction in the gray bar as well. So I think for the dental team, the last 2 weeks have been very tough with, I anticipate layoffs and furloughs and things like that. So that's an important finding we got out here. And again, some variation, I would say not too much in this case, but again, solo dentists on the top, and on the other spectrum, very large groups on the right or on the bottom. So you do see some slight differences with in both waves. The very large groups were least likely to be paying their staff fully, and slightly more likely to be paying them either partially or not at all. And you know, in the first wave, if you look right at the top, the week of March 23rd, solo dentists, I mean, almost a third of them were paying their staff fully, compared to a quarter of very large groups. But both of these groups have seen a significant reduction in paying their staff in the last 2 weeks. Again, similar by DSO. Again, DSO correlates with size, so we're picking up a little bit of that effect too here. But again, DSO dentists were less likely than solo dentists to be paying their staff fully. But again, both groups saw a pretty big reduction in the 2 week span. Let me move on now to the question of the week that we put in. And I think this is where I want to spend most of our time, because I think it gave some incredible insights. This was the question of the week we asked. So the questions I showed you before about, are you open or not? What is your typical patient volume? What is your typical collections? And are you paying your staff? Those are core questions that we're going to be asking every 2 weeks going forward. We also have the capability to add in a specific one-off question. The one we did last week was this one. And let's read it together. Current CDC guidelines recommend dentists delay non-urgent procedures through April 30th. The situation is highly uncertain, but which of the following options would you consider to ensure the sustainability of your practice if the current restrictions on dental practices were to continue through? And then we asked through the end of April, through the end of June, and then through the end of August. So let me try this. So that's here. 3 scenarios. Suppose current restrictions are continuing through the end of April, through the end of June, and through the end of August. And then we put some potential responses up. Those are the rows you're seeing. Would you find innovative ways to expand your patient base? Would you find innovative ways to lower operating costs? Would you borrow money? Would you adjust staffing? And then I don't think I can sustain my practice. I would close, sell, or declare bankruptcy. And then there's some other options. So here's what we found in terms of how dentists are responding to this question. So the way we look at this is, let's go slow. Let's look at the end of April, which is kind of the status quo. That's the situation now in terms of CDC and ADA guidelines. And those are the dark purple bars. So what we're seeing here is, you know, roughly 1 in 5 would say I'd find innovative ways to expand my patient base. But the real action is in these 3 columns here, which is I would adjust my staff, I would borrow money, and I would find ways to lower my operating costs. That is what through the end of April, people are doing, basically. Now, if we go to the end of June, we get those teal bars, and things change a little, but still the most likely way dentists say they'll handle the situation is through expense reductions and borrowing. And again, incidentally, if anybody's interested in learning more about what are the specific borrowing programs, the PPP loans, the EIDL program that was launched through the CARES Act, the Congressional Relief Package, all that information is available on ada.org/virus. But where things get, I guess, very troubling, or we see a dramatic changes in the end of August scenario. And that's where you see the green bars here start to really shrink, right? The borrowing is not going to be effective. The reductions in expenses is not going to be effective. We start to see many, many more people indicating that if things go like this through the end of August, I don't think I can sustain my practice. So our take on this situation is that the next few months are critical, frankly, in the terms of sustainability of a lot of dental practices out there. That is what these data are showing. Now, we don't know where the situation will turn. Right now, we're kind of till April 30th, and depending on what governors do and where the situation turns, we could have soft reopenings, we could have sequenced reopenings according to types of care, we could have some states fully lift restrictions, we could have some states continue them. We don't know, but what we wanted in this sense, and what we really wanted to get after with this question last week, was like, what is the long-term or short-term sustainability month to month? How long can you last in this current situation? And we got our answer here. For a month or 2 to 3 months potentially, it seems manageable, so to speak. Obviously, it's very negative, but it is doable. That's my big take here. The game changer happens if things don't really improve dramatically through the end of the summer. Now, look, we're all following what epidemiologists saying and what the CDC is doing and what the reopenings look like in South Korea and China and other situations. Frankly, I still see there's a lot of uncertainty around how this will go. But we'll know in a few weeks kind of what the plan is, or maybe earlier for dentistry in terms of the ADA issuing some guidance. But this is what the data are showing. And let me just split this up now by some of the analysis we looked at. So this is just illustrative. We picked 2 of the large states. Again, not much difference in like the shape of these charts. But it does, these data suggest that, for example, in Texas, the crunch or the hurt may come earlier. We have a quarter of dentists in Texas reporting that, even if this goes through end of June, which is the teal bars, which is, 2.5 months away, this is a serious situation. A quarter of dentists there are saying in Texas that they're going to have trouble sustaining their practice. California, we have a lower number, 17%. But again, by August, everybody starts to be like, this is serious. Some differences here by DSO and non-DSO dentists. I think, I would have expected to find the reverse. But here it's suggesting that dentists in DSO settings seem to be more likely to report, I can't sustain my practice, than other dentists. Now, some of this might be an age issue. We know that younger dentists are much more likely to be in DSOs than older dentists. So we could be picking up an effect that younger dentists early in their practice that are affiliated with the DSO might be feeling the heat more. Things like, I have student debt, I'm just starting my practice. Perhaps that's explaining this. I don't know, but these are some interesting things we found out. And part of having you all on board is to help us make sense of this. So send some suggested reasons why this might be happening into the Q&A. And then, oh, well, here it is. So we can actually look by age. And well, this suggests that my earlier hypothesis is not supported by the data, because it appears here that older dentists are most likely to be saying, I can't sustain my practice, compared to younger dentists. And again, we have, I didn't bring all the age groups here. These are just the youngest age group we look at, and then the oldest age group we look at. Among the 65 and older, I would think a lot of that blue and green responses is potentially I'll exit, I'll exit earlier than I thought, right? If dentists think, look, this is going to be different clinical standards and different protective equipment requirements, plus the recovery is going to be slow, maybe it's not worth sticking this out another 3-4 years, or 2 years, I don't know. I would think that the older are most likely to be considering early exits in the market than the younger, and these data suggest that. But they don't seem to support the hypothesis I had for the DSOs, that the DSO dentists seem to be younger and probably they're most likely to be exiting. These data don't suggest that's the case, that age is driving that. So that is all we wanted to cover today. I will, just before turning to Q&A, so our website's on the screen, and this is how you can get in touch with us. Again, the survey results are online. Not all of the charts I showed you, but the basic descriptive statistics and the state-by-state data are all in there, as well as the comparison of the 2 weeks. So one of the things, before I open up for Q&A, just to plug for next week, April 29th, and you'll get more information on this. We're going to have a panel discussion. We're still finalizing who's going to be on that. But we really want to talk about kind of where the future might unfold. And a big thing is obviously what people are predicting for the economic recovery. And I just want to give some teasers here. I find this chart very useful, and it's what economists have been talking about exclusively for the past 2-3 weeks, is like, what is the shape of the recovery? We're obviously in, I don't know if it's technically been defined or not, but we're in a very, very deep economic contraction. Over 17 million people have applied for unemployment. I think we had the largest quarter-versus-quarter shrink in GDP in recorded history, etc. We all know this, right? Things have slowed down. But the recovery can be what we call like a V-shape, which if you look to the top left, this is what happened in Canada in the financial crisis. Deep decline, but then a acceleration back to where the trend line was in terms of economic growth. It could be U-shaped, which is what the US went through during the financial crisis. That's where things kind of don't ever really catch back up to the trend line. You have the growth rate resuming, but you've kind of had a one-time big loss in economic activity that you don't regain and you don't catch up to. And then you have kind of the worst case scenario, which is, for example, what Greece went through and what economists call an L shape or a hockey stick. I'm Canadian, so I see a hockey stick there. You basically, you don't get back anywhere close to those historical growth rates in GDP. So not only have you had a huge one-time loss, but you actually never catch up. And you never even catch up in terms of growth. So you're in this new normal of very, very stagnant economic situation. Now, for the time being, most economists are debating whether this will be V-shaped or U-shaped, and then how quickly we get, if it is V-shaped, back. And as you imagine, I mean, things change week by week. A lot of it depends on the epidemiology of this pandemic, the extent to which testing gets effectively rolled out. You're following the news just like we are. A key to reopening the economy is the availability of testing and to selectively open certain industries back and certain people, frankly, especially if there's antibody testing available. But right now, there's no concrete plans or accepted direction on that. It obviously depends also on whether we have a second wave of the pandemic in the fall/winter. And, you know, some people are saying we could have intermittent social distancing for the next 2 years. Some are saying a vaccine's on the way and we'll be back to business, you know, early 2021. But anyway, that's just a plug for some of the stuff we'll be talking about more future oriented next time. But now let me pop through some of the questions here. And I guess we'll just be taking those a little bit in order. So thank you all. We got a ton of questions. And again, this will all be recorded so you can share it with your friends and colleagues after. Okay, how do you expect COVID will impact Medicaid dental access when things open up and with school openings? Haven't thought a lot about that. I would think probably perhaps in the same way it affects the general population, certainly on the provider side. I don't know enough about whether Medicaid dentists or dentists in FQHCs have been kind of practicing as usual, so to speak, versus those facilities delaying dental care except for emergencies as well. I guess the big issue related to this question is probably what happens on the patient side and the population side. And we certainly do know that the pandemic is disproportionately affecting minority communities and low-income folks. There's a lot of data on that already. So a lot of this has to do with where people place dental care in their life and in their budgets, let's say. And even if you're fully insured in terms of priority, once we start kind of moving up, let's say Maslow's hierarchy of needs, away from shelter and food towards, you know, some of those being healthy. And, you know, I can imagine people have delayed a lot of types of healthcare, and we don't know where dental lands there. So I don't have a good answer on that one. Second question, okay, what are the newest recommendations for PPE, and how might this affect practices? We don't know, but the ADA is going to come out with something soon on what are guidelines in terms of reopening. Again, the current policy or the current recommendations are through the end of the month, so we have a group working furiously in our science division and others practice group, trying to come up with recommendations so dentists will know. And then the issue becomes, what is the cost implications for practices to, you know, either change their infrastructure and potentially have differences in how the rooms are designed. And people have talked about negative pressure. Again, I don't know much about that as an economist, but, you know, presumably even enhanced masks and face shields would come at some additional cost. So again, we don't know how, let's say, like onerous the new practice protocols will be yet, because they kind of haven't been developed and launched. Hopefully we get one, I can have a more concrete answer. Okay, do you have any idea when dental practices will begin to open? Stay tuned, there'll be something coming out from the ADA. I don't know what that is. It is still being developed. Obviously states have their own prerogative for recommendations. As of now, we are where we are through end of April, and there's nothing new today. And if that's the case in the next few days, then it's looking like the end of April could be where there's some process of slowly reopening dental practices. But I don't know, stay tuned. The ADA will say something on that in the next few days, as I understand. Okay. COVID-19 could lead to a 34% reduction in dental claims this year, a 7% reduction, and a 5% reduction in the years to come, from Think Advisor. Do you agree with these numbers? Do you have an opinion on claims? Stay tuned. We're doing an analysis that is a different methodology. I don't know if this is the study referencing something else or the paper that Milliman, authored by Joanna Fontana. That was, to me, a very, very good first take based on claims analysis on what the magnitude of some of the reductions will be. In 2 weeks, we'll have a better answer. So hopefully you'll see that report and you will join us for a webinar. We are just in the midst of doing some modeling. It's a different methodology. But my hunch is that our assumptions may be a bit more negative than what this analysis did. So in terms of at least the impact on dental spending for this year, my hunches are estimates will be even larger contractions, at least for 2020. Okay. Any data on Medicaid population as concerns request for treatment? I'm assuming you mean on the population side of beneficiaries in Medicaid and whether they're able to find treatment. And I'm sorry if I misinterpreted the question. There's a related one about Medicaid-focused practices losing significant patient volume. We did not ask that. That is actually a good suggestion. We may poll dentists on, are you active in Medicaid? And then that way we can see if they're seeing a disproportionately negative effect. I don't know. I don't have a good answer on that. This is great. We're a lot of good things for our team to work on here on this. Okay, was the slide on procedure needed to start based on GP specialists or both? So it wasn't on procedures, it was the actual dentist. So the slide where we had endo, perio, it was how periodontists and endodontists and oral surgeons responded to the question. So it's actually by specialty, not procedures, but practitioners. Okay, next. Do you think the paying staff answer will increase to providers paying more staff because of PPP and having to use 75% towards payroll to be forgiven? Great question. So a more general sense, how have the relief efforts the last 2 weeks, if I may paraphrase, how could they potentially affect the share of staff being paid? We will know when we launch our next round of data collection next week. That's one of the great things, is we'll be able to compare. As far as I know, or most people are predicting, the money authorized by Congress for those relief programs is likely to run out this week. They may reauthorize more, but it's a great point. Whatever money was distributed will have been distributed. And next week we'll see if we have a stability in the paying staff question, a rebound, or no effect. But that is a great question, and we will know when we collect data next week. Another thing I want to plug is I mentioned to all of you that the team has space for a one-off question of the week. I'm going to throw it out there. If anybody has suggestions on what you think is most pressing, you've now seen what our survey does. You've seen what the focus is. If you have suggestions for areas we should focus on, especially those kind of on the industry side, if we have insurers or manufacturers or distributors or others, let us know. Some of the things we were recommended to look at was, did you get a loan from the government? Others have suggested we focus on, do you have access to enhanced PPE, and we can list out what that might be. So we'd appreciate your suggestions on that. Okay, next one. Do you anticipate many dentists availing themselves of PPP loans from the SBA to try and keep more staff employed? Similar question I just answered. We'll know next week. We'll have a sense of how many have gotten it, and whether that has impacted their decisions regarding their staff. Okay, somebody asked, why are we not seeing small group charts? I just selectively picked some of the extremes. If you go look at the report, the data are reported also by small groups as well. Okay, I'd be interested in a breakdown of procedures being performed. That is a great question. It's not a data set we have in real time. I'm sure there are others in the market that have kind of access to real-time data. But we, on our April 29th webinar, we've invited P&R, which is a company that analyzes a lot of this kind of data. So join us on April 29th, and hopefully we can ask our distinguished panel. Okay, answer this question too. How many dentists have received loans? Okay, here's a wonky question, but we love these. How are we accounting for potential bias around dentists that are closed fully or partially and may have more time to participate in a survey like that versus those that are busy? Great question. We don't. But all we can say is when we look kind of by age, by gender, by practice structure, we are pretty representative on that. Issues like this are always one of the shortcomings of surveys. But honestly, given the nearly 20,000 responses we got the first wave, I don't know, we feel this is as representative as you can do with this kind of methodology. It would be great to have a random sample of people's practice data, like if we had, and there's others that do this, other companies that maybe have monitoring those kinds of data, but we don't know. Great point. And I feel this is the best we can do. Okay, give me a minute to sift through some of these here. Okay. I think it will be difficult to reduce costs due to PPE shortages or gouging. I don't see when PPE will be available to dentists. Great point. And obviously this is a concern. This is why potentially we thought next week to ask dentists, how reliable is their supply chain for enhanced PPE, sorry. But it likely will increase practice costs slightly, and that's kind of probably part of the new reality. And again, a huge thing here is to reinforce, and you hear this a lot in the debate on the news, right? Is the important role of testing, right? So in a world where we had comprehensive testing in dental offices, it's a game changer, because you could potentially, take negative results if somebody doesn't have any presence of the virus, and even if we had antibody testing, somebody that's immune. And again, I'm not a clinician, I don't know the protocols, but potentially, right, that could be something where there's a different maybe PPE standard for that or not. But testing is very important for the long-term recovery. And that's something the ADA is working on to explore when testing does come online. How might that, how might we make sure that dentists have access to that? Because it's important for being able to treat the population and keep the public safe. Okay, somebody who's a dental assistant. Do we have data on where the job market is going for this? long-term prospects for employment in dentistry today. Like I wish we had good answers. Give us a little bit more time. We just stood up this survey. We're trying to collect real-time data. I think this gave us really good information on the gravity of the situation. And clearly the next 2-3 months are critical, right? We saw that jump. If things go like this through the end of the summer, there's a significant share of practices that can't survive this. If things start to slowly open up soon, let's say even starting in May, and the population starts to come back to practices, it'd be a much more tampered down negative effect. But we don't know. We're going to do some modeling. Give us a couple weeks. Join us back April 29th. We'll have something on that there. Okay, somebody just said New York on pause until May 15th. Okay, so Governor Cuomo announced before this webinar in his address. Okay, so there's a state that's already taken a decision. I'm assuming you mean on elective procedures. Okay. Okay, somebody again there. It's a repeat question. Perhaps the DSOs are more linked to the administrators making business decisions versus the clinician. Perhaps that could be one thing. We don't know. Okay. Okay, this is an interesting one. I think that the sustainability of the practice over time may be associated with the amount of money that practitioner is comfortable borrowing to sustain it. Yes, and it would be interesting, and I don't know if anybody online has some intel or insights on, other than the federal programs for relief, does anybody have data on increased borrowing? So a lot of our surveys suggested that is a serious tactic in the short term. But it'd be great to see, like, what amount are we talking about? Like, how much is lending increased, right? But great question, great suggestion. Are any dentists doing private appointments, only one patient at a time to comply with social distancing requirements? Okay, that, I don't know, that may be, so I'm assuming you're talking about just the geography, well, not the geography, the layout and the movement within the office, including waiting room and how you shuttle people to and from to maintain social distancing. I don't know, but I'll ask around. This is not something we had any intel on. Okay, question on CHCs, community health centers. Gotten this a few times. This round of polling so far is really focused on kind of dentists and private practice. I am open to see how things compare with community health centers, so we'll take that under advisement. A few people have said, look, why don't we poll dentists in public settings and see how this may differ. So let's take that as friendly advice, and let's see if we can do that. Okay, is the ADA going to be setting guidelines for how we are to practice with testing patients for COVID prior to their appointment? Guidelines will be forthcoming. I believe it's the next few days. I don't know if it goes into testing. Because frankly, right now, there is not a reliable test that's very widespreadly available and returns results in very short turnaround. Okay, coming from an education environment, it would be interesting to hear your comments on employment projections for new graduates. Will dentists hire or stop hiring? That's a great question. So again, it depends a lot on how we assume the recovery goes. Is it this drawn out U-shaped? Is it this sharp V-shaped? Give us a couple more. I think I'd be comfortable commenting on that in a week or two once we finish some of the analysis. But it's very interesting. I mean, I don't know, I just on LinkedIn, there's various dental groups that are recruiting now. You know, one of them is like Walmart. I saw that Walmart Dental is recruiting at this time, right? So if you followed the work out of HPI, the broader macroeconomic picture, though, is not really changing in terms of, like, we've had some long-term trends of declining dental care demand among like working age adults and like all self-pay patients other than seniors. So if you want, I mean, HPI is an annual report. It's for sale, but we've analyzed all sorts of long-term prospects. I would think even some of those, I would say, were let's say maybe, I don't want to say concerning, but it suggests that certainly in saturated markets like upper and income areas, upper and middle income locations, urban areas, are probably going to see like stagnating demand for dental care, and that's where a lot of graduates want to go. So I don't think it's going to be universal effect. I'm sure there are going to be both geographies and settings, and patients that are maybe insured by Medicaid are probably going to have different reactions to this than like the you know, people who relied on their company for dental insurance, right? I mean, if unemployment spikes and people lose coverage, we know that that is going to have a negative effect on practices that operate with a significant patient base that is employed and commercially insured. But I do think, at least in the short term, we're going to see, you know, significant contraction, and I don't think necessarily everything bounces back in a month or two at all. Okay. Okay, someone talking about the spit test. Why not have the dental office do spit tests? Again, I don't know enough about all the specific technologies and tests. I do want to challenge the idea that dentists own spit. Honestly, I feel there's so many people that can take swabs or take spit samples, that certainly dentists operate in that area, but I would not say they own spit. And I don't want to be contrarian. It's just the reality that a lot of people can do those kinds of tests. What I do want to say is I feel that dentistry has a new opportunity here to be like a point of care to the public for testing when it comes online, irrespective of your dental care, right? At some point, we're going to need to have massive testing rollouts. And dentistry really, I feel, has an opportunity there to step in for the sake of the public, to be like, we're an area that can administer these tests, right? Okay, we didn't get through a lot. Hopefully we'll figure out a way to type in these answers, and hopefully they're captured in the recording. Again, my team is all in different locations, different parts of their place. Hopefully this first one was enjoyable and informative.